Okay, so I'm going to kind of start from the beginning. My name is Tracy Carmack. My bachelor's degree is in bacteriology. I'm a certified clinical nutritionist, and I had a naturopathic practice with my husband, Ken Whiteman. So we have practiced on the other side of the table. So hopefully that will be a benefit when it comes to strategizing some protocols, explaining mechanisms, and helping you through this process of understanding the total gut restoration.
Okay.
So I found microbiome labs when I was researching the microbiome of the soil. We have a ranch in northern Idaho, and there were many problems. We realized they were aerial spraying Roundup from the airplane 3 times a year. All of our neighbors on our road have cancer, and the local physician who gave a lecture on GMOs, and I thought was going to be bringing some recent information, was saying how beneficial GMOs were, that Roundup was so safe you could coat your tongue with it, and that there was no problem, there was no association between the pesticides and the different cancers that people were experiencing. So I began my study of the microbiome, and it led me to microbiome labs. And I've been very amazed about how their research is really leading the industry, both in the probiotic world as well as in the stool testing world. Both of those areas have been turned upside down because our founders are really just putting out information that is well grounded and supported in science. And our BiomeFX stool kit is the only kit that the FDA actually awarded an accuracy. So that's what we're striving to do, is always to lead the industry science first. So when we put together a gut healing program, we call it the Total Gut Restoration. This is the foundation protocol for all gut conditions. And we have focused on the 3 areas, the reconditioning, the reinforcement, and the rebuilding. This is very different than you've seen in the past, where there was a focus on reseeding. What we know now, after the microbiome project and the American Gut Study, is that we don't reseed a microbiome. The best you can do is to encourage the good commensals and to discourage any pathogens. But after 2.5 years, that unique fingerprint of a microbiome is in place. So what you can do is influence it, and we do that with the spore probiotics, which are transient. They colonize within the gut for 21 to 24 days. They are passed out through the feces. They're usually to go back into the soil, where they will use the soil as a vector, and then they will wait until a mammal, insect, or human ingests them again. And this is the cycle that's been going on since the dawn of man. So we haven't invented anything new, except just putting back this cycle of these spores, because their exposure to our GI tract is very important for the development of our GI tract, including the training of our immune system. We have found that infants that are not exposed to these spores will develop immune autodeficiencies. So they're very much intricately involved with our gut. So those 3 areas that we focus on, the first is the focus on mucin 1 layer. And you'll see that this is the role of where megaspore plays the biggest part. It helps keep this beautiful diversification as represented by the different colors. Here are different organisms that make up the microbiome. The gram-negative bacteria naturally shed lipopolysaccharide, and it is an endotoxin. But in a diverse environment, it's absorbed by the mucin 1 layer, and it doesn't cause any harm. when it is recognized by secretory IgA and arrested, and that's part of the natural control mechanism. The second phase, this reinforcement phase, it's reinforcement of these keystone strains that are very important. We know that strains such as Akkermansia musciphylla, Faecalibacterium perniciae, Bifido longum, and other Bifido species are very well cited in the studies, showing that they associate with better health. They associate with reducing inflammation and helping the mucin layers and helping with diversification and production of butyrate. So that's why we focus on increasing those strains in particular. The third area is this build up the mucin 2 layer. This mucin 2 is a thick gelatinous coating that protects the underlying epithelial cells, keeps the tight junctions tight, and keeps the microvilli free of any pathogens. So what happens in the case of leaky gut or metabolic endotoxemia is the lack of diversity to buffer the lipopolysaccharide, the polysaccharide degrading mucin 2 layer, causing a breach in the epithelial cells, which then allows for the passage of undigested food, lipopolysaccharide, and pathogens. And then, of course, then it's recognized by the immune system where this cascade of cytokines and interleukins takes place, which is that underlying inflammatory level that is the source for all chronic illness. It exacerbates all the inflammation in the body. So what our total gut restoration program is designed to do is to reinforce those 3 critical areas to put back into place the integrity of the gut. So this slide goes through all of the different conditions that lipopolysaccharide plays a role. And that's why we have focused on metabolic endotoxemia, because of so many connections to chronic illnesses in the body. And these are each supported in the literature. This is the study that we had published in 2017 in the World Journal of Gastrointestinal Pathophysiology. And it was really our groundbreaking study that put us on the map. And we focused on what we feel is the origin of autoimmune disease, diabetes, Hashimoto's, rheumatoid arthritis, all the connections to chronic illness. And what this study showed was not only did it reduce the endotoxin lipopolysaccharide by 60%, but it also had great significance on all these other analytes, each of which are their own independent study. We have now recently, well, the endotoxin one was published in 2017, but this one just came out just last month, and it showed a significant drop of 20 to 30% of triglycerides, again, just using a probiotic, which makes sense. If you're truly sealing the gut and stopping metabolic endotoxemia, then you should be able to affect all of those chronic illnesses. And what we're seeing is that is playing out. We have an ongoing study with ghrelin and leptin in a weight loss study. We have a Hashimoto's, a rheumatoid arthritis, and all of these indicators showed that they would initially go down, and what these studies as they're being published are showing that it's proving out. And this is really good news, that if you focus on the gut, you can really get at the source of all of these illnesses. Now, this is the type of studies that are really the only way to check probiotics, to really see how they perform in the body. And this is a simulated human intestinal tract called a SHIME study. There's 2 facilities in the world that do this, one in Belgium at Ghent University, the other in Canada. So we use the one in Belgium. And this is how we found out by, first this is inoculated with a microbiome, and then it simulates each section of the gastrointestinal tract. So when you feed it something like a probiotic, you're able to tell how far down the gastrointestinal tract it is able to go, if it colonizes, if it does, what does it produce, and then how does it really get along with the other organisms in the gastrointestinal tract. So we fed it different types of probiotics, and that's how we know that a simple lactobacillus or bifidus combination without being in a spore form is going to die in the stomach. It's going to be digested in the really low pH. That doesn't mean it doesn't have a function, because you know there are studies on different lactobacillus and bifidus strains, but it's not because it survives the gastric barriers and colonizes. It's because even digested bacterial protein and DNA have a quorum sensing effect on the microbiome. And it will change an analyte, or it will have a specific function. But it's only one strain, one condition. They only work while you take them, so it's very limited. Compared to the spores, which in this endospore can get past the gastric challenge, colonize in the upper intestinal tract, and have 32 different effects on the microbiome versus one. So this is another study we recently had published. It is showing that megaspore is going to have a significant effect on these keystone strains and basically jumpstart them. But it's the oligosaccharides in the prebiotic that really feed these organisms and help them to thrive. And again, it's these populations having a healthy diversity in the gut that long-term is going to keep the individual healthy. So, you know, we've talked about the study and the influence on the gut by megaspore, being able to buffer the lipopolysaccharide and help with diversity, and how the prebiotic is able to feed those keystone strains and help them thrive. And now the mega mucosa, what it does is it has some amino acids that are specific for the goblet cells of the gut to help them produce that mucin 2 layer to seal the gut. It also has concentrated immunoglobulins in the form of IgG 2000, which is a G, M, A, and D, and that's going to non-specifically bind to the lipopolysaccharide, viruses, and parasites. So it works terrifically to neutralize the toxins, to act like a binder in the gut, to soak up exotoxins, endotoxins, and tag viruses and parasites so that the immune system can see it, and it really boosts the activity of the secretory IgA. So those are the three components of the total gut restoration. We always start these products low and slow. With Megaspore, it's one capsule every other day for a week, and then one capsule a day for a week. And then by the third week, you're at the recommended dose at 2 a day. You're taking these spores with your largest meal. So with food is more optimal. And then on the second month, you're starting the prebiotic at half a scoop for a week, and then continuing the rest of the month with a full scoop. And then by the third month, you're starting the mega mucosa, which is a half a scoop for the first week, and then a full scoop for the rest of the month. And then at the end of that 3 months, the powder should be gone, and you'll maintain with just Megaspore 2 to 3 times a week. And most people, 80% of individuals, are going to have no problem with this titration or this system, and you'll see vast improvements in their gut. What you want to watch out for, though, are the 20% of individuals that take up 80% of your time.
Yeah.
So these are the individuals that they have a difficult time titrating the Megaspore. They may start out with 1 every other day and then start complaining of GI type of side effects. The first thing they want to do is stop taking the product because they associate pain with something wrong. But what this is the microbiome resisting change, even though it's good change. The body finds homeostasis. So you want to encourage them to just cut in half whatever dose they were doing and to start slower. What is happening, if you have gut damage, you're going to have a damaged immune system. And the immune system is the body's recognizer. So it doesn't recognize megaspore and because it's damaged. So if you start slower, the spores will actually improve the immune system. So it helps modulate the immune system and train the Treg cells how to recognize again. So they will, be able to recognize what they should instead of being oversensitive. So the typical approach is just cut the dose in half, and half of those 20% are going to be fine. Now you're down to the 10% that have to cut the half dose in half. Some of these individuals will just sprinkle the powder. You can open up the capsule. You can, if you divide it in half, put half in one glass, half in the other glass, and just fill on the first day, the first glass with water. You don't want to pre-mix the spores and save it because it'll begin to ferment. So tell them just to add water to it or put it into a food just before they want to consume it or to take any. There is the rare occasion, there's a 1%er out there that can't even dust the spores. They have such a dramatic response. For that reason, we have other probiotics that have fewer spores. For instance, this one. The real workhorse of megaspore is the organism Bacillus subtilis, and its strain number is HU58. HU stands for Holloman University. This is a spore bank that's in London. Only credible manufacturers will use a spore bank because they're completely genetically typed. These are where we get the spores, where the pharmaceutical companies get the spores to make the pharmaceutical drugs. Each of these spores individually are a drug in Europe and Southeast Asia and have been for the last 60 years. But they're not available in the United States. So I say that just so that you know there's a lot of history and a lot of research behind these spores, so they're very safe. Now the HU58 was, this is a published study that we have showing that just this one spore by itself has a dramatic effect on interleukins. It reduces interleukin 6 by 45% and TNF alpha by 55%. We've got another study coming out showing that this organism reduces ammonia dramatically. So much so that Mercy Hospital has a ward just for hepatic encephalopathy. I'll say that again, hepatic
encephalopathy.
Yes.
Encephalopathy, yeah.
That one, yes, for liver failure. And they use this product as part of their standard of care because it dramatically reduces ammonia. This is another SHIME study that we had published. This one shows that megaspore is more effective than rifaximin for IBS. So you'll see more of these studies that come out because even though we went after the underlying condition of metabolic endotoxemia that affects all of these conditions, IBS, diverticulitis, ulcerative colitis, Crohn's, we're still going to go back and do the individual studies for each of these conditions. And this is one of many that will be coming out. This is our 2-spore probiotic. It also has the HU58, the Bacillus subtilis, but it has the second spore, Bacillus clausii, and then a yeast, the Saccharomyces boulardii. So
Okay.
there's different reasons you would want to use these 1 or 2 spore probiotics. The first is that, as I mentioned before, you're titrating megaspore, you're looking for sensitive individuals. With HU58 and Restore Flora, you don't need to titrate. With this few of spores, it's not going to irritate the immune system for someone who has a damaged immune system like megaspore would. So in cases where you don't have time to titrate, Restore Flora is nice, such as your patient comes in and says, oh yeah, I just started antibiotics yesterday. Well, in that case, you don't want to take the 3 weeks to titrate them up on megaspore when you can start them right away. You've got the Saccharomyces boulardii in there to go head to head with the Candida, which is the primary side effect of antibiotic use. So that, for that reason, it's good to have on hand. Another is if you've got an extreme overgrowth, like C. diff or MRSA or an extreme SIBO. In that case, we will add all 3 of these probiotics together to competitively exclude the pathogen or just completely populate them out. And that way, we basically throw everything we have at it, because these individuals many times are just 1 foot before they go into the hospital, and we don't have the time. Again, they would rather deal with whatever mild gastrointestinal side effects they might have versus having to go to the hospital. So that's when we would use all 3.
Okay.
Now, many times when you're working with a microbiome, underlying conditions will come up that either the patient was aware of or they didn't know what symptoms were associated. One of those conditions is candidiasis. So if you start, or they may present in the first appointment telling you that they have a yeast infection or candidiasis. This is an extremely effective formula. It's called Mega Mycobalance. It has 2 antifungals, one in the form of undecalinic acid, which is derived from castor oil beans, which is very antifungal. The other is bee propolis. And the reason this is different is other antifungals act as a lawnmower, basically, and will remove the candida, but they leave those root-like hyphae that are embedded in the underlying epithelials. Undecalinic acid stops hypha formation. So then it's not able to bind, and then it's just removed from the body.
Okay.
This
And
is
when you say candidiasis, do you mean candidiasis that is in the gut, or any kind of yeast infection, like a vaginal yeast infection?
Yeah. We believe that all microbiomes, vaginal, head, skin, is connected to the gut microbiome. So we want to treat both.
Sure. Okay. Yeah.
So we do
Okay.
the oral program and products, but very often we've got practitioners that will make up a topical solution, for instance, using the spores, use the spore as a suppository. So just know that there isn't an orifice that our spores have not been in.
Okay, great.
And it's not that they will colonize in those other microbiomes. The idea is these organisms have a chemical surveillance system, and that is what is basically putting the environment on alert. This quorum sensing gives them the ability to know who's in the environment, how many, and what species. Other bacteria have that too. So just having the presence of these spores will change the environment for the good.
Okay.
This is another handy product because very often we'll get these individuals that may have chronic diarrhea or acid reflux. And what we're finding is a lot of it is associated with phase 2.5 detoxification, which is under the control of bile. So if bile is sluggish in an individual that has upper dysbiotic organisms, that dysbiosis will unconjugate the bile, release the toxins that they're trying to remove from the body, and recycle them. Those toxins irritate the lining of a damaged gut and can cause a diarrhea. Sometimes it causes constipation, and very often it'll cause a reflux. It also causes an area that is very conducive to H. pylori. So this is a combination of artichoke leaf that helps the liver flow, the licorice flavonoids, which reduces the H. pylori, and ginger root, which helps with gastric emptying and transit time. So we've had a lot of good feedback with this supplement because it seemed to have really hit the nail on the head in situations like ulcerative colitis, where they reported having, chronic diarrhea for years, and then just with a few days of taking this product, it stopped. And I think that's only because it was that bile effect on the damaged gut.
Okay.
Wheat rescue, because we're seeing everyone affected by wheat. It's an inflammatory food. Some individuals cannot tolerate it at all. This product was designed with them in mind. It has those specific enzymes that break down gluten and gliadin, and so that it is not immunoreactive. And then it has some of the Bacillus subtilis and the coagulans and the Saccharomyces, so it keeps the gut restored at the same time. So this is a nice combination. This is an important aspect because actually our first product was menaquinone in the product called megaquinone. It's a vitamin K2. And a healthy gut would normally, healthy gut would normally make vitamin K2. It's a fermented extrahepatic vitamin K, and it has real important roles in regard to mobilizing calcium from soft tissue and putting it back into the bone. And we're seeing a rash of depleted K2 because of dysbiosis in the gut, and in some cases the overuse of vitamin D3 or D3 without sufficient K2. K2 has to be at least 300 micrograms in order to get to the human host. And most K2 supplements on the market have less than 90. The gut itself, the microbiome uses K2 as an energy source because it's a quinone. And if you have sufficient K2, then you've got enough going into the tissue in order to cause the calcium to be ionized in a carboxylation reaction and mobilized back to the bone. So this is ideal for individuals. It's a list here. Okay. We've found information as far as cancer, cardiovascular disease, diabetes, osteoporosis. In the male infertility, it's helping the mitochondria of the sperm. And then we did a clinical trial on an aspect that wasn't well covered in the literature, and that was on cardiac output. So what our study showed is our form of K2 increases cardiac output by 13% and blood volume by 30%. So this was a huge boost for circulation, great for athletes and those who want to get more out of their exercise.
Okay.
And then most recently we had Mega Omega, which is a fish oil specifically for the gut with some benefits in PRMs, because again, we're trying to do everything we can to reduce the inflammation in the gut. And this particular fish oil has the best benefit that we've been able to find. Then we also launched a megaspore basically for dogs called Phytospore. We have a Romanian study that will be published soon showing that dogs suffer with the same metabolic endotoxemia as their owners, probably caused by their owners. And we have a terrific probiotic that can help them. And then we launched a stool test, reluctantly, because we found that all the other stool tests out there that all of our practitioners were sending in these sample reports, and we studied them and found that at best they were only 50% accurate. So we had decided if we're going to get into the stool business, we've got to find one that you can sample from in the same week and get similar results. These other tests, that is not the case. You can sample every 3 days and get completely different results. So we went with one that was actually the lab that did the Human Gut Project and the American Gut Project. So they have the most reference samples on the planet, over 600,000. That's how we're able to do both alpha and beta diversity. And in context, that's very important, that you not only know what is normal for your particular microbiome, but your geographical area, which varies from place to place. And other companies do not take that into consideration. And this is the only lab that has ever received an accuracy award by the FDA. We are 98% accurate, and that's going to make all the difference. So we do all of the bacterial ratios that are important for characterizing the microbiome. And not only how much the gases, for instance, ammonia, methane, and sulfate are produced, but how does the body clear it, as well as how the body's clearing the estrogen and from the organisms that create estrogen dominance. And also do a resistome. So it's giving you an idea of how resistant your microbiome is and how much it will protect you from infection. And now more than ever, we're really realizing how important that is in this recent pandemic, because it's hard for some individuals to explain why someone would be susceptible and others would not. So this, I know, is a lot of information. If you
it's great. Yeah.
Do you have any patients in mind that you might want to talk about a protocol?
Yeah. I think my first question for you is about contraindications.
Mm-hmm.
Who shouldn't I use your products for?
Well, there would be very few.
And I'm thinking people who, just in terms of like, is there any, there are several, I've seen many studies, or not many, but just kind of touting, it's kind of the conventional medicine response to anything outside of its normal wisdom that says, oh, this thing is dangerous and we don't know enough about it, so you shouldn't use it. So in terms of like seeding somebody's body with any kind of probiotic, including yours, to potentially introduce infection or cause a problem. So
sure. To resolve
in terms of like
that
safety study,
yes, well, we did a study. We can show with our spores that even with HIV, which HIV is actually a severe metabolic endotoxemia, because the virus targets the CD4 cells in the gut, which it loses complete recognition and destroys the immune system, where our study shows that that's the area that megaspore, the spores, help, is the recognition of the Treg cells. And the fear about probiotics is that they could go systemic and cause a septicemia. So that's why we chose probably the most serious of conditions, and it did not do that.
Great. Okay. Alrighty. So then patients. So I have so many patients that have reflux or SIBO. The one I'm thinking of most recently is a patient who does have chronic diarrhea, who, she's also got an anxiety disorder. I just sent her to the gastroenterologist for a colonoscopy, and looks like she had some ileitis. They didn't find any eosinophils. She doesn't have a microscopic colitis. And on the previous stool testing, and I have used Genova in the past, I don't, I find it somewhat helpful, but not entirely enough to kind of direct me. So for her, it's looking like she's got, and she does actually have Hashimoto's as well.
Okay.
But her major complaint is and she actually also has hypertension. And she is, how old is she? She is 49 years old. So basically her major symptom is the kind of uncontrolled diarrhea.
Okay. Well, I was trying to pull up here this paper on dysfunction and depression that have everything to do with the integrity of the gut. And I think that's one thing I would, talk to the patient about too, is that association between gut and brain, and that
Absolutely.
our spores actually produce serotonin and dopamine and help with the inflammation in the gut. And it's the inflammation that blocks the neurotransmitters from making, from being able to make neurotransmitters, and stops that balance. So fixing the gut has everything to do with helping the emotional state. That MegaGuard, I think, would be a great place to start, because she's not only got the SIBO, the reflux, and the diarrhea, all of which have everything to do with that secondary bile salt conjugation effect. So it would be very interesting to see, and with any one of those conditions, which are already one of the benefits of MegaGuard, there should be amazing improvement in the upper digestive. And then I would start the total gut restoration very soon after that, because if you've got upper digestive issues which have broken down the pH barriers, there's a trickle down theory. It's also going to have the individual will have lower digestive issues and damage. So it would make sense to seal the gut.
Okay, great. Yeah, I have so many patients I could ask you about. Let's see, what about chronic constipation patients? I mean, that kind of gets back to the same bile issue, I think, but I have a handful of those as well.
Yeah, it could be the toxins that are released from the bile, but we know definitely that the endotoxin lipopolysaccharide that's released from just commensal gram-negative bacteria, in high amounts, it shuts down the bowel as well. So that's why individuals have to understand that, especially in the beginning, when they're using Megaspore, and if they have a history of constipation, they need to continue all of those things that they have realized are so important to keep themselves regular. The exercise, the good diet, stress issues, water. They don't want to stop doing that. Yes, Megaspore will eventually help with the healing of the gut, but the worst thing to starting a new protocol is to get someone who gets constipated, then they're miserable and they don't want to continue the program. So that IgG.
And what, I would say that most of these, sorry, go ahead.
Well, we have these standalone product IgG 2000 to help with the lipopolysaccharide because it neutralizes it. So in individuals you already know are extremely toxic, you might want to pre-treat them with IgG 2000 to soak up as much toxins in the beginning so that they'll have a better experience.
What kind of time frame are you talking about for that?
As far as pre-treating, a week,
Uh-huh.
yeah, just a week prior, and to keep it on hand. Any type of die-off symptoms, drinking water and taking IgG 2000 is always the answer.
Okay. Great. Let me think. And in terms of the pretty much kind of garden variety SIBO patients, that primary symptoms are gas and bloating and some dysbiosis, is that, if I'm hearing you correctly, this is where the total gut restoration really plays a role, and we don't have to mess with the whole rifaximin, neomycin, flagyl, what about berberine? Yeah, and you know, all of these, like the thing that's kind of driven me crazy is all these really complicated protocols.
Right.
And then the patients, you know, they're just like supplemented to death.
Yes.
They're not going to do it,
That's what
basically.
we have a simple philosophy about it's the terrain. And if you can get, you know, in the total gut restoration, get the right environment, you know, do that first, then you shouldn't have to use any killing agents and additional products, because it's the environment that is self-maintaining.
Okay. And what would you say in terms of people with the, you have a lot of folks that are doing elimination diets as well, which I kind of have a problem with, because I mean, I don't think it's a bad idea initially if there's some things that they're really reactive to, but a lot of them eat themselves into a box where then they only tolerate 6 foods, or,
Right.
you know, things like that. And that's just not living. That's not enjoyable. And so it seems to me what you're describing would involve the use of the program, with them, as their landscape changes, being able to add their foods back in.
Yes, the sign of a healing gut is to be able to increase the diversity of your food as well as the diversity of your gut.
Yeah. What about celiac patients?
I can't say that I know of an individual we've completely healed from celiac, but I know we have made their life vastly better.
And which products do you think would most benefit somebody in that situation?
But certainly they would do the total gut restoration. They would maintain with Megaspore, probably at the recommended dose instead of the maintenance dose. They need to keep that dose. And then they would add to that the wheat rescue, just to make sure that there's no flare-ups, because we know that even gluten-free restaurants and gluten-free diets still have about 30% of gluten.
Yeah. And then what about the Hashimoto's patients?
The mechanism is that metabolic endotoxemia, where the breach is of the epithelial cells. And so focused on sealing the gut, so doing the total gut restoration is going to be the foundation.
Okay. And then I have another patient who's quite interesting, and I was very interested in the whole ghrelin and leptin study that you have ongoing. This is a patient who is close to 60, hyperlipidemia, gets recurrent lung infections, has problems with weight loss. She's intolerant of statins, and she had kind of this series of events. She is hypothyroid as well, but she had this series of events, starting with the arthroscopic knee surgery at the time she was newly menopausal and getting hormone replacement therapy that resulted in a DVT and a pulmonary embolus. after they treated her for that, eventually they stopped the medicine, and she had a recurrent pulmonary embolus and is on the medication Xarelto like forever. And so she, you know, she's always looking for, I suspect a lot of this has to do with her landscape. Her microbiome is not doing well. She's not tolerant to statins. She's been to the cardiologist, and she's a mess basically. And she's super frustrated because she can't lose weight. You know.
Yes, so many of the symptoms that you listed there have everything to do. We've got a documentation, of course, on weight loss, the Firmicutes ratio to Bacteroides. You know, Megaspore is able to shift these ratios of organisms. Our clinical study showed that it's going to drop those triglycerides, which is an indicator of not just liver inflammation, but also gut inflammation. You know, and all of these, the biochemistry of, you know, the body is so dependent on what ratios of bacteria are in your gut, how you actually, you know, conjugate your hormones, your minerals, your vitamins. So many of these other, you know, cardiovascular effects are the downstream effect of having the wrong ratio of organisms. And the vitamin K2 is going to be extremely important, just because all of aging is basically a slow calcification, what's happening to the body. So things work better when you remove that calcium, and tissues are more pliable. And that has everything to do with the vitamin K2 levels in the body.
Great. And then one other kind of patient. So another young lady, really interesting. She's 18. Growing up, had a lot of allergies and asthma, and was treated with a lot of antihistamine, Singulair, steroids, both oral and inhaled. And probably 4 or 5 years ago, developed this reflux that she saw everybody for. They tried to call it eosinophilic esophagitis. However, none of her biopsies or anything ever proved that. And she's had since then this malabsorption and food intolerance and weight loss, amenorrhea, because she's so tiny and skinny that I don't think she's got that weight threshold to have a menstrual cycle. So I'm really worried about her bones. Actually, she was using the Megaspore product for a while, but I don't think she did the whole program. And recently she saw another gastroenterologist that gave her some Creon, pancreatic enzymes, that has helped her digestion a lot better. But then the other wrinkle on it is that we tested her, and she's got IgA deficiency. So we tested all of her immunoglobulins, and so her IgA and her I want to say it's her IgM are low. So, you know, she had like recurrent infections growing up too. So I'm wondering about your program for her and specific products to kind of boost her, if that's possible, and somebody who maybe has a genetic immunoglobulin deficiency. Is it possible to help them out? You know, how, and specifically how?
Yes. So it could be she didn't know about the total gut restoration because we've only had that program in place for a year. So that might explain why she hasn't done the whole program. Our IgG 2000 product is very helpful for immunoglobulin issues. Now, it's only going to be in the gastrointestinal tract. It doesn't go systemic, but when the gastrointestinal tract is improved, the entire immune system of the body improves. So we can see if we can raise secretory IgA using IgG 2000 and the Megaspore, then you'll see it improve. The whole level of immunoglobulins in the body will improve.
Great. Okay, that's wonderful.
I wanted to mention, when you mentioned the SIBO, and you said, yes, the total gut restoration is foundational, but also that upper digestive tract the MegaGuard, because we're seeing SIBO is more of a digestion problem than it is a translocation problem. The only reason the bacteria will translocate to the upper digestive tract is because their zip codes have been removed, and that's the pH barriers. And so the MegaGuard is going to help restore the pH barriers and help that environment by helping the bile.
Okay. Okay. So you're saying MegaGuard in combination with the total gut restoration?
Yes, and you can do that right up front, because if they are already suffering from any type of GERD or reflux, then you start them with that product. A few days later, go ahead and start the total gut restoration. I'm just always big on starting a product by itself and not in combination,
Yes,
so that you
same.
can always back off and know what
Right,
caused the last problem.
right. Okay, and I think I have one more for you. So I have an 80-year-old plus gentleman who had a total knee done, and somehow that implant got infected, and then they took it out and redid it, and still has a problem. It's not MRSA, but sees the infectious disease specialist and is basically on an every other day dose of Keflex now.
Wow.
And if he starts missing a day or two, his knee flares, starts to get infected again. So it's like this threshold of infection. And so I'm sure his gut is just like not, yeah. And he takes the PPI chronically. He's a newer patient of mine.
Okay.
Yeah. So he's got all kinds of badness going on to mess up his microbiome.
Yes. Start the spores, whichever ones, as he's taking the antibiotics. The antibiotics will not hurt the spores. They have that quorum sensing. They will stay in the spore form if it's in the environment of a killing agent like an antibiotic, and then it will recolonize, resporulate. So you want to keep it in his system at all time so that it's always cleaning up the damage whenever it has a chance. And there was another point you had mentioned about using with the antibiotic. Oh, the PPIs, the MegaGuard.
Yeah.
If you go ahead and introduce that at the same time with the PPIs, and it'll do a better job. And then I would start weaning him off the PPIs just for long term. That's a recipe for disaster.
Right. For sure. And so then in regards back to what you said about the antibiotics and the spores at the same time, if you've got somebody who's going to need, like a longer course of antibiotics or being given antibiotics, or are you saying that how do you time, if they're taking an antibiotic once a day or twice a day, how do you time the product with that?
You could actually take them at the same time. It's again, the spores will stay in the spore form. Most people are
I
used
just want
to
make sure that's what I understood what you were saying.
Yes. If it doesn't matter if they split it up, but just know you can take it at the same time. You're not going to hurt the spores.
Okay.
Wonderful. And that goes with natural, natural products, oregano, biocidin, any of what we would call a killing agent. Again, it won't hurt the spores.
Right. Okay. And then in terms of getting the patients going, I haven't played too much with the website in terms of the patients coming on, buying the products, and me making a recommendation for them. So what's the best recommendation for that?
Yeah. So we have a program called Patient Direct. So you would upload a W-9. So that is what triggers a check. Once your patients order up to $200 of products, then that triggers a check to you. It'll give you
Mhm.
a
Yeah, I think
link.
I've already done that part actually. Yeah.
Okay. And that link you can put on your website as well.
Okay. Okay. So then I can just direct them as to what products to get and what order and all of that.
Yes.
Okay. And then for using the tests then, yeah, I'd love to start using your tests and kind of see how people are doing and that sort of thing. Is there a recommended time frame that you for doing a follow-up test after you're doing the total gut restoration or any of the other products?
4 to 6 months. So you do the pre-test, go ahead and start them on the total gut restoration. They complete the total gut restoration in 3 months. So you've got some wiggle room in there to get them another test within about a month and then get a good idea of the changes. So to
And
get
do
a
they
hold,
need to be off of the product before the testing,
no,
repeat testing?
no.
Okay.
To get a hold of the products, when you place an in-clinic order that's being shipped to you, there's a pack of 4. It's no charge when you order product. And then before you register, you'll get a barcode in the kit. It's that barcode that you would register on your website. And then at that point, you're using either the patient's credit card or your credit card to pay for the kit at $2.99. So there's, again, there's no charge to actually get the kit in hand.
Okay. Alrighty. And then what about kind of back to the patients with constipation? You know, they're typically already coming to me on a bunch of laxatives. So some kind of magnesium at the very least daily, and then maybe whatever else they use to do that. So it seems like as things are righted, they would be able to back off
Yes,
on those, except for, you know, their colon becomes dependent upon them for the motility. So
right.
I don't know if you
Yeah,
have comments about that. Yeah.
yeah, just they stay on it, like you said, until they can realize that the problem is resolving. Um, you know, there's times that they may need to repeat the total gut restoration. It may relieve the constipation. Then if they get challenged again, have to go on antibiotics, have a crisis in their life, things that will mess up their gut, they may need to repeat it.
Right. Right. And then what about continuation, like a maintenance program? I think you talked about that at the beginning.
Yes,
For
it's,
somebody who's doing well. Yeah.
yeah, just maintaining the megaspore 2 or 3 times a week. So whatever works well
Oh,
for
that's right.
someone.
Okay.
Some people just take it on the weekends because
Okay.
you're just maintaining that 21 to 24 day colonization.
Great.
And know
Great. I
that
think that's all the questions.
when you do a test, we
Go
do
ahead.
have more support for interpreting. So once you get your test result, we set up there's a link I'll send you, and it'll set up a consult with a specialist to go over that result so that you're learning, you're getting your questions answered, and you're prepared to interpret for your patient. We also have 5 modules
Great.
that our microbiologist has done on each section of that sample report. Again, because this is really pioneering new area, and we want you to feel as confident about the science and the technology as possible.
Yeah, for sure. Great. Well, this has been wonderful. Yeah, this is like an answer to my prayers, because I have all these super complicated people that come to see me, and you know, a lot of them have seen a lot of other practitioners already, and they've tried a bunch of things, and I'm very much into simplicity. So,
Yes. Yeah, and I think,
yeah.
truth is in simplicity. And if we can get at the real root cause
Mhm.
of all of these conditions, then it vastly cuts down on how much and how long people have to, because they do get burned out taking supplements and going from doctor to doctor. I
Yeah.
think this is really going to
Right.
be cracking into what makes all the difference.
Mhm.
Something for you to know about
Wonderful.
too. Um, we really
Mhm.
want to get into the weeds as far as the science that's going on around the world with microbiome so that we're always staying cutting edge. So last year we did a keynote presentation in Huntington Beach and just
Mhm.
invited those practitioners that really wanted to be on the cutting edge of microbiome science and brought in kind of the world's experts. This year we're going to do it in Scottsdale, Arizona in November. So you'll see some
Mhm.
banners
Okay.
on our website and on my email. And just know that that's
Mhm.
something that you might want to consider because you are really looking at a lot of these complex conditions. And I think I just have a really good
Yeah.
feeling that you're going to become one of those microbiome experts.
Hmm. Yeah, I'd love to just know as much as I can, and I understand that it's an evolving science. So,
Mhm. Yes,
yeah, well,
super.
great.
Well,
Yeah.
I'll send you more
I thank you so
information on
much for
that.
your time today. It's been invaluable. Yeah.
Please keep my number handy. I would like to be a resource for you. Reach out anytime. I have some docs that will say that there's a patient across from them and have a question. If I can help you in a pinch, I'm happy to do that.
Wonderful. That's great.
Thank
Very
you
good,
so much.
Tracy. Anything else for
No,
today?
no, I'll keep sending you information. We've got, like I said, some good education modules that are available, and I'll get you started on those.
Great. Alrighty. Well, stay safe. Have a good weekend.
Thank you so much. You too. Bye-bye.
Bye-bye.